No matter how conscientious you are about protecting your health and that of your family, there's something you need to know. There's an array of unnoticed silent killers at work. Among the most catastrophic of these killer diseases are diabetes, heart disease, and colorectal cancer. Over 20 million people in North America have diabetes, and 90% of these have type 2. More than 10 million Americans have a cholesterol level that's too high, which can lead to heart disease or stroke. And 90% of colorectal cancer cases involve people over the age of 50, which is why regular screening is so vital.
Diabetes, heart disease, and colorectal cancer are all, to a degree, treatable. However, the key is early diagnosis. Unfortunately, many patients don't present to their physician for testing until they have symptoms, even advanced symptoms. The availability of over-the-counter test kits would certainly allow patients to treat themselves, take control of their health care, and present to a physician for treatment earlier in the course of disease. It should have a major impact.
Irvine, California-based EarlyDetect recently introduced 3 home screening kits: EarlyDetect Glucose, EarlyDetect Cholesterol, and EarlyDetect Colorectal.
The EarlyDetect home screening kits, I think, represent a significant opportunity for patients. My first concern was the reliability and the accuracy of the tests. And I must say, on looking into it, I've been extremely impressed. Comparing the tests with standard lab methods, they're reliable, they're accurate, they're simple, and I think they'll be of great help to patients in the home environment.
I believe that EarlyDetect is creating a paradigm shift in the healthcare industry, allowing people to become their best health advocates. EarlyDetect is not in any way trying to compete or keep people from physicians' offices.
These products are ideal for anyone who is interested in taking responsibility for their own health or that of a loved one. EarlyDetect tests come with full illustrated instructions, making them easy to use. Quick and convenient, the complete test can be performed in minutes in the privacy of your own home. These tests offer a 99% accuracy rating and are FDA approved. The low cost makes these vital tests available to everyone.
The recommendation for using these kits varies from kit to kit. For example, with colorectal cancer and cholesterol screening, the general recommendations are that it should begin by the age of no later than 40, and if there's a family history, should probably begin earlier than that and perhaps be more frequent.
Anyone on medication for their blood cholesterol is now able to monitor the effectiveness of their cholesterol-lowering medications.
Well, with type 2 early onset diabetes, I think that the recommendation is that people should begin to screen for glucose levels earlier in life because the disease has an increasingly early onset, particularly if there's a family history and particularly with the so-called epidemic of obesity that's occurring in the U.S. today.
The EarlyDetect glucose entails basically adding a drop of blood to the test device, waiting 3 minutes, and reading the results with 99% accuracy.
Here's how to use it. After fasting for at least 9 hours, before breakfast is ideal, wash your hands thoroughly. Choose a middle finger on your non-dominant hand and use the supplied lancet to puncture your finger. Deposit a drop of blood on the indicated spot on the test card, and after 3 minutes, peel off the top layer. You'll have 30 seconds to compare the resulting color with a color chart.
EarlyDetect's cholesterol test is a lifesaver. By adding a drop of blood to the test device, waiting 8 to 15 minutes, you can read the results with a 98% accuracy.
Lance your finger and apply blood to the cholesterol testing device, much as with the glucose test. After 3 minutes, pull out the tab on the side of the cholesterol tester. In about 10 to 12 minutes, the 2 indicators will change color, letting you know it's time to compare your results with the supplied chart.
Blood in the stool can indicate several different types of health concerns. One, of course, is colorectal cancer. The EarlyDetect test is able to find blood in the stool that the naked eye can't see. And the test is a very clean test where there's no handling of the stool.
First, you'll verify the chemistry of the water in your toilet. There are full instructions on how to do this. After a bowel movement, you simply toss in a sheet of special testing paper and watch for a color change. It's recommended to do this 3 times over several days. With any of these tests, watch the expiration date on the package. Don't expose the test materials to direct sunlight or moisture, and never share or reuse a lancet.
These tests are not designed to be definitive, but then they should never replace seeing a physician.
With the availability of the internet, patients are better informed about health issues than ever they were before, and they can get more information, so they can become more involved in their health care. And I think the availability of home testing that's self-directed can have a major impact on both the patient's health and also on overall healthcare costs.
I like the EarlyDetect cholesterol test because my family has a history of high cholesterol, and I can take this in the privacy of my home with quick and accurate results.
EarlyDetect is also available to healthcare providers.
We're thrilled about moving the patient out of the centralized lab setting and bringing them to physicians, urgent cares, and health clinics. This allows the patient to have a rapid, accurate test done immediately and can help save their life.
EarlyDetect. The earlier, the better. To learn more about EarlyDetect home screening kits, phone 877-5-TEST-4U or visit www.earlydetect.com.